Our recording has started. Thank you so much for being here. We do have a wonderful speaker with us this morning, and I do want to thank the students for popping in and joining us this morning as well. As students come in, I will be muting and ensuring that any questions, please go to the chat. Okay, good morning. So my name is Damari Nix, and I am full-time faculty at the Health Information Technology program at St. John's River State College out of St. Augustine. We are pleased to partner with NAFIMA, the Northeast Florida Health Information Management Association, to offer these monthly lunch and learn sessions featuring the stories of health IT and health information management professionals that really serve our students. Please make sure that as we get started, if I haven't yet muted you, please go ahead and mute yourself, but do ask questions in that chat box because we will be coming back and Larissa, and making sure that we address the questions and our speaker. If you are attending this session for course credit, please ensure to put your full name in the chat so that way I am able to report that for full credit. And we can move forward on that in that way. And the session is going to be recorded for future access. So today, our speaker is Barbara Dearmon. Barbara is a manager of the Oncology Data Services at St. Vincent and is going to, one moment, and is going to explore opportunities in tumor registry with the class and with all the participants this morning. So thank you so much for being with us today. I'll turn it over to you, Barbara.
Thank you. I'm going to talk a little bit today about opportunities in cancer registration. The work that cancer registers do reports up to several different regulatory agencies. I would like to thank everyone for the opportunity to be able to speak about my role and what I do. My objectives will be to discuss career paths in cancer registry, as well as discussing different roles in cancer registration, and discuss how each role supports prevention and screening today. Let me tell you a little bit about my career path. I went to school, St. Petersburg Technical Institute, to become a medical secretary. Never did any medical secretary work. Ended up in the cancer registry as a file clerk. Received all of my training on the job training. When I started 30 years ago, there was no formal education. You did not have to have a two-year associate's degree or higher to become a certified tumor registrar, but over the last maybe 10 or 15 years, that has changed. I started off as a file clerk. That's an entry-level position, and then I started doing follow-up, which follow-up is a required operation of the cancer registry to monitor patients for lifetime. An abstractor is one that collects data, analysis, and helps monitor quality measures. And a coordinator is someone that typically oversees operations within the department, and I've served in various leadership roles over the last 20 plus years. My current background includes a Bachelor's of Science in Healthcare Administration. I also do a little bit of work on the outside of Ascension independent contracting for healthcare facilities. I wear multiple hats. I'm still serving on NCRA. I'm a past president. I've actually served on the AHIMA Education as the AHIMA Education Content Coordinator, on the Certification Council, Nominating Committee. My current role is the chair of the Education and Formal Education Committee. And then I also serve on an outsourcing committee task force. I am currently a distinguished member of Florida Cancer Registrars Association, so I'm still active at a state level as well. Let's talk a little bit about the cancer registry workforce. The cancer registry workforce, the most common workforce is your hospitals and university settings. Then you have your freestanding cancer centers, radiation oncology centers, medical oncology, dermatology, urology, as well as your clinical laboratories are required to report cancer incidents. Then you have your vendors, your pharmaceutical companies, public health, and your veteran facilities, as well as your regulatory standard setters, which we'll talk a little bit more about. The VA probably has a different platform for reporting cancer registry incidents, but they're still required to utilize the same rules and regs as all other cancer registries. And what's coming into play now is natural language. So you got a lot of companies coming in with the natural language enhancements for capturing cancer registry data today. A lot of it is done via extracting information from the electronic records with a couple of type of various imports where you can import demographics, the coding information that comes over from the coders and the billing platform. The benefits of becoming a cancer registrar. The work that we do, we collect data on cancer statistics for various healthcare organizations. You get the opportunity to work very closely with the healthcare team to support your cancer program at your organization. Cancer registrars analyze clinical cancer information for education. It supports research as well as monitoring patient outcomes. It gives you the ability to monitor compliance with quality of care as well as practice guidelines. The standard occupational classification for a certified tumor registrar is called a medical register. CTR professionals are required to capture the complete history, diagnosis, the treatment, the site-specific data items, prognostic indicators, as well as the staging and core data items on all reportable cases according to regulatory guidelines. CTR credentials is required for accredited hospitals and you can work in a hospital and be CTR eligible. So I just hired, I believe I just hired a staff member, Stacy, from St. John's River State College. She is considered a CTR eligible candidate. She has her RHIT credentials and she's actively enrolled in formal education and is being groomed for success to sit for a CTR exam 2 years from date of hire. A CTR is strongly recommended for cancer incidence reporting only, but may be required in some states. CTRs are required to participate in educational activities annually. I personally feel that you should participate in educational activities as often as possible because the regulatory guidelines are changing very frequently. Some of the abstracting opportunities that exist, you can become a lead abstractor. That's someone that oversees or works with their team of cancer registrars collecting data. A cancer registrar can support the survivorship program. A lot of quality is taken into account for the data that's being collected. It must be reliable data, so you have to have someone monitoring the quality of data on a regular basis. You can also work in data management. There are several types of remote opportunities. My team, since COVID-19 hit, the entire department is working remotely from home through the end of the calendar year into January. And also you have independent contractors. Independent contractors are typically a facility that does not house a tumor registry department, but is required to report to the central registry. So you may have a CTR just reporting on incidents, reporting only to the Department of Health. In a leadership role, the leadership role may vary depending on the type of organization that you work for. And this particular role will require oversight of cancer registry operations, maintaining accreditation with regulatory agencies, as well as monitoring state reporting, your staffing, your budget, and you may be required to serve on several type of committees. In my role, I serve I do all these responsibilities in my current role. And then I also participate in leadership formation where they continue to provide you education on building your growth, professional growth as a leader. I report up to the director of oncology service line. So I'm a manager and I report up to my director. I don't have a supervisor nor a coordinator, but I do have a staff of 5 certified tumor registrars, and their job duties may differ. I utilize their strengths and their skills to assist with other duties besides abstracting. A cancer conference coordinator is another role that a certified tumor registrar can serve in. But if the registrar serves in this role, they cannot do both abstracting and be a cancer conference coordinator. This particular role supports the COC, which is Commission on Cancer Accredited Programs. And this particular role would be required to monitor 7 required areas of listed below. So all accredited programs are required to have cancer conferences. And then there's 7 areas that are monitored: case discussion, the frequency, the attendance, the type of discussion, whether it's prospective or retrospective, discussion of staging, your clinical trials, as well as your national guidelines. And this information is required as stated for accredited programs. Something that's new that's on the horizon is a position called Accreditation Specialist. So I don't have an accreditation specialist. I am the accreditation specialist for Ascension St. Vincent's. My job is to monitor compliance with the Commission on Cancer and the National Accreditation of Breast Centers. I maintain the supporting documentation annually with the NAACCR committee, as well as the Cancer Committee. I am responsible for updating the survey application ongoing. I serve as a member on the Cancer Committee as well as the NAACCR committee. And I coordinate both meetings and take minutes. And my director and the chair of those committees work with me to maintain supporting documentation. And both programs are surveyed every 3 years. So in my current role, I do all of these duties, but there's more positions today or organizations that are dividing that responsibility up. So instead of the cancer registrar lead serving both the role in monitoring cancer registry operations and accreditation, they're creating a separate position. Florida Cancer Data Systems is the central repository. They're considered a standard setter because all freestanding facilities, hospitals, clinical labs, surgery centers, radiation oncology are required to report up to Florida Cancer Data Systems, which is the Department of Health. There's several types of opportunities at this level. You may have to go back to school to get additional education to serve in some of the roles, but they do hire CTRs to assist in different areas. You can be a project administrator, you can assist with data management, and their data management is monitoring the incidence reporting from all the healthcare organizations throughout the state, as well as monitoring the quality control and providing education where it's needed. And of course, Florida Cancer Data Systems is monitored by the Department of Health, which reports up to CDC. Some of the other opportunities at the central registry level that cancer registrars can look into is into statistics, data validation, computers, and administrative support. So, but keep in mind, you may be required to go back to school to get specialized training to work for some of the regulatory standard setters, but you can be a certified tumor registrar and work in some of these other areas. The American College of Surgeons oversees cancer programs, and they have opportunities as well. So the American College of Surgeons is the standard setter for surgical care, monitoring quality of care, and standards for accredited programs. So they can also monitor trauma programs, cancer programs, the breast accreditation, and they just rolled out the National Rectal Accreditation. So Commission on Cancer, the American College of Surgeons is going away from, not going away, but adding site-specific accreditations. So they'll be rolling out more of those accreditations for cancer programs. But some of the positions that are available at that level are project management, data managing the database, registry, you got nursing, you got finance and accounting, you got information technology and statistical analysis, as well as quality improvement, education development, marketing and communications, meeting, planning and administration, administrative clerical support, and human resources. So they have a lot of opportunities that job opportunities at that level. Some of them that are more specific to the cancer registry is an NCDB data user support specialist. This would be a role where that individual will support cancer registries that report up to the National Cancer Database Repository, which has just released a new platform called RCRS, which is Rapid Cancer Reporting, where you'll be reporting data real time, monthly to the National Repository. The American Joint Commission on Cancer Technical Specialists is someone that may support capturing the cancer staging information and assisting with educational opportunities. And then you have the National Cancer Database Manager and Quality Reporting and Analytics. So there's all types of positions that are out there that cancer registrars can look into. Next, we're going to talk a little bit about SEER, which is Surveillance, Epidemiology, and End Results Opportunities. SEER provides information on all cancer statistics in an effort to reduce the cancer burden among the United States population. SEER is supported by Surveillance Research Program and NCI's Division of Cancer Control and Population Science. SEER is considered a standard setter for the cancer registry population. Some of the common position or job opportunities that are available is becoming a statistician, informatics, computer programming, being a project manager, researchers, and CTRs are some of the common positions that are available. Next, we have the North American Association of Central Cancer Registries. NAACCR develops and promotes uniform data standards for all cancer registries for reporting cancer registration. NAACCR promotes use of cancer surveillance data for all central registries in the United States for cancer control and epidemiologic research, public health, and patient care. Some of the positions that are available is being a cancer registry consultant, researcher, or technical specialist for AJCC, central registry jobs with quality control, abstracting management, and being an abstractor. They also offer internship programs for people that are interested in working at that level. And you can be a CTR and work for NAACCR. NAACCR establishes also the data dictionary for capturing all required core data items for the cancer registry. The Center for Disease Control and Prevention, the National Program of Cancer Registries, represents 46 states. So you have 46 states that are reporting data. And on 96% of the population, and 100% is combined with the National Cancer Institute. It also includes data from the District of Columbia, Puerto Rico, the U.S. Pacific Islands jurisdictions, the U.S. Virgin Islands, also receives funding from the CDC on reporting up to the National Program of Cancer Registries. Cancer Registries provide the data, which is the driven foundation for cancer control throughout the United States. It also helps monitoring clusters of cancer, incidence of cancer, trends, and mortality. CDC uses the cancer registry data for cancer control. One of my favorite YouTube videos is from Dr. Richardson, where she talks about how the cancer registry data assists with measuring the progress we've made with monitoring cancer incidents. Do I have time to click on the link and show this to the students? Yes? No?
Yes, you do.
Okay, so I'm just going to share this with the students, and this will give you more insight on how the data that's captured by the Cancer Registry, which is reported up to the Central Registry. The Central Registry reports to the National Program of Cancer Registries. That information is utilized by SEER and then CDC as well. So I'm going to click on this and let the students listen to this recording from Dr. Richardson.
Cancer affects us all, either directly or by affecting someone we know. The numbers are sobering. 1 out of every 2 men and 1 out of every 3 women will develop cancer in their lifetime. Today, I'd like to talk with you about the importance of collecting and using provided by the National Program for NPCR. Cancer is a major public health problem in the United States. Premature deaths, lost productivity, cost of cancer and its treatment, and the long-term effects of cancer and cancer treatment on quality of life all take a huge toll on everyone, from the person with cancer to society as a whole. Understanding the scope of the cancer burden better begins with knowing more about the people who or have had cancer. NPCR program supports 45 states, million new cancers located, widely in its spread. NPCR supported cancer formed the backbone, providing data on population. When combined with data, the data from these cancer cases allow us to answer many important questions. Getting cancer in America. What kinds of cancer are on the rise? Kinds of quality? Where would prevention efforts have the biggest impact? Are screening and answering these questions will help us to learn more about cancer and ultimately find ways to more effectively prevent and treat devastating disease. To investigate public concerns, monitor trends and incidents, and identify groups of people throughout the United States may be at increased risk. We also use the data to support and strategic plans for cancer control at the local, state, and national level. The ultimate goal of reducing cancer and cancer-related. But it's not only the CDC that uses registry data. Lawmakers can see if certain policies have been, like including access to diagnosis and treating cancer earlier, when it's more effective and less, and encouraging healthy vaccination or quitting smoking that lead to fewer people. These data are available to cancer control planners and researchers. They're available on the CDC website. Anyone can chart the progress we're making on cancer in the United States. NPCR, Cancer Registry programs, and hospitals that collect these data enable the crucial work. Without registries, our efforts against cancer would be desperate. Cancer registries give us the information to know how to best use our resources and if our efforts are paying off. Applying registry data in cancer control literally saves lives.
So some of the CDC careers that are available is being either a public health advisor, a health scientist using informatics, a program specialist, epidemiologists, and statisticians. And like I said previously, you can be a certified tumor registrar and serve in these roles, but you may have to go back to school and get additional education in order to, meet the eligibility for some of these different job opportunities at the government level. Cancer Registry Curated data supports cancer research, the national goals and priorities. It helps to monitor and improve prevention and screening. It allows us to monitor standard of care and quality metrics, patient outcomes, and improves cancer treatment. It ultimately saves lives. Any questions? Do we have any questions?
Barbara, this is Damari next again. I will go ahead and ask a couple of questions that I have, if you don't mind, and I will really urge students to type in the chat any questions that students might have. If you wish for me to unmute you as a student so you can ask your question directly, please just tell me in the chat that that's the case. But I will go ahead and start by asking this. Have you, Barbara, in your role as a cancer registry professional, seen a trend either way in terms of the cancer trends in the United States since the U.S. began its protocols for COVID-19?
What type of trend? Trend downward or trend upward?
That's my question. Has there been a change? Have you seen that can be attributed to perhaps people not seeking treatment or not going to the doctor, or the focus being shifted?
I think it has shifted. This is just my personal preference.
I am asking for a personal opinion. Yes.
Yeah. So I would say due to COVID-19 hitting, okay, and then there being a halt on all types of operations throughout the state of Florida, has definitely impacted patients coming in and being treated with cancer. So I'm expecting to see, when we start analyzing our 2020 data, it may reveal a decline in the number of patients being seen, diagnosed, and treated due to COVID-19 hitting. And then in addition to that, you have all of the government agencies like American Cancer Society, Commission on Cancer, that have implemented measures for the cancer registry to capture 6 different data items to monitor the impact of COVID-19 on cancer patients.
That is really interesting. So there is already, from what I'm hearing from you, Barbara, is that there's already concern, right?
Yes.
Okay. All right. And that is even more important. So you see that as your role as cancer registry professional even more important now, right? Because now we're tracking data on top of more data for COVID-19 purposes.
Yes. So when my team starts analyzing 2020 data, because we're dealing with a backlog right now for 2019, we will now have to capture, I think it's 6 data items related to COVID-19 on cancer patients.
Thank you so much for that. Now, Suzette Hardiman has a question for you as well. I have unmuted Suzette.
Can you hear me?
Yes, I can hear you.
Okay, so I've been at UF Health for like 20 years, and I remember years ago I went for the position. Basically, I'm not gonna go through that whole spiel, but basically I lost out to somebody who already had the experience. So from there I looked, about the tumor registry. Do they have anywhere in Florida that you can get the tumor registry at, like as a degree? Because I know that they have a degree because I did a little background
Okay.
work
So,
on.
so Suzette, most of the formal education programs are online. You can visit ncra-usa.org. There's about 10, maybe 12 programs that are online. None of them are in the state of Florida. You can go online and get a formal education degree. You can get a 2-year degree, or you can do a certificate program. If you are already a RHIT student, I would go the route B to get a certificate. So that probably would take you maybe 1 year to complete the certificate program through a HEMA, but you would still have to complete your virtual 160-hour clinical practicum before you can sit for the CTR exam. Did that answer your question?
Yeah, I was just wondering, do they have one like in Florida?
No,
But
I really wish I could develop one in Florida. I would love to be the teacher.
yeah, because I was speaking to a lady, she said the same thing. Just in passing, I just noticed her badge, and she said that when she became a registry, you didn't have to have certification.
No, the way it is today is for most hospitals have accredited programs in Jacksonville. All the hospitals are accredited, and to work in an accredited program, you have to have your credentials.
Okay.
Or you can be CTR eligible, like I said, the student that we just hired. She already has her RHIT. She's actively enrolled in formal education. So we're going to continue to groom her for success to sit for her CTR 2 years from date of hire.
Okay. That's pretty much it. Thank you.
You're welcome.
Thank you, Suzette, for asking the question. At this time, I'm going to ask other students to please type your questions in. In the chat, Barbara, it
Yes.
says, okay, wait, one of your slides, it states that 46 states report covering about 96%, if I recall correctly, is what Melissa is asking. How come only 46 states report? What are the other 4 states that do not report? Why are they not included? Do they have a large volume of cancer diagnosis? Just wondering.
I can't remember. What I could do is I will research that question. I know that there's 4 states that was not reporting, but I will look into that and provide you the answer to that. I don't know which 4 states are not reporting at present.
Okay, and we don't know why they're not reporting either.
Correct. It could be a state legislation. Not 100% sure.
Okay, so I will definitely look for that so I can go ahead and forward that to Melissa, and I'm sure Charlene will do that as well, Dr. Banta. So
Yes.
thank you so much for that. I know that is probably something you're not focusing on, right? Because it's not for the state of Florida, likely.
Correct. The state of Florida mandates reporting. So, like I said, there is 4 states out there that are not reporting, but I think they're on the West Coast. I'm not 100% sure.
Okay.
And they might be smaller states. So, but ultimately the goal would be for CDC to have all 50 states reporting.
Very interesting. Mallory Scott is asking, being a cancer registrar, does this occupation have a lot of emotional takeaways?
No, I would say it's more gratifying because the work that we do ultimately benefits the cancer patients. It supports national initiatives to monitor trends, mortality, and it aids to improving treatment as well as supporting cancer research.
Okay. All right. And I'm going to go with Mallory on this. When I used to think of cancer registry, I used to think that maybe we would be seeing patients alongside, but really you're focusing on the data, correct?
Correct. So
Okay.
so I don't see the patients. No, it's more of an administrative monitoring of data. So you don't necessarily deal with the patients unless you're working in a clinical environment. Like if you're doing survivorship, if you're supporting survivorship, you may deal with patients. If you're a patient navigator, then you'll deal with patients. But the work that we do is more so non-clinical than clinical. The work
Okay.
that we do supports clinical.
Wonderful. Yes. Larissa asks, is a cancer registrar mainly a remote position, or do we see this position mainly in person?
It is not mainly a remote position. For my department, we were all on staff until COVID-19 hit. And when COVID-19 hit, we all transitioned to working remotely. So we have access to our desktop via VPN. So we have to log in via the Ascension server. We can use our personal computer, but you have to have a two-step process to be able to log on to the Ascension server. So they have a lot of security measures in place. You do have some organizations where they've already been working, their entire team has already been working remotely from home for years. I think Moffitt Cancer Center, they have a staff of 23, which is out of Tampa. All of their staff works from home, and then my colleagues in Orlando, she has, I think it's a staff of 15, and they all work from home as well. It depends on your job duties. If your job duties allow you to work totally remotely from home, then yes, you can do it. With my department, we have other job duties that require us to be on site. So at the time prior to COVID, we were not fully working remote. Does that answer the question?
Larissa, please chat if it does. Oh, yes, wonderful. It did.
Okay.
Yes. I thought so as well, Barbara. Georgia asks, I heard you mention how you are working with an employee on becoming a CTR over the next 2 years. Is this common practice among many hospitals and other healthcare organizations?
I'm going to say no. No. Typically, most organizations will hire or look for a staff member that has two years or more on the job experience. I had a seasoned CTR who resigned and found another position, and I was unable to locate a certified tumor registrar. So I opt to go with training a candidate to become CTR as long as they met the educational requirements in order for me to hire them. So my candidate that I hired, she already had anatomy and physiology background. She had her RHIT, and she's actively enrolled in the formal education for cancer information management via AHIMA. So this allowed me to hire her, bring her on staff, and then because she's in an accredited program, she will be required to sit for her CTR exam 2 years from date of hire.
Okay. Wonderful. If there are no other questions, I still have a couple of follow-up, if you don't mind, Barbara.
Sure.
So you discussed that because this student is already an RHIT, she is able to work toward her CTR over the next 2 years. As this is a registered health information technology program, how do you see students benefiting from having this credential, not just with CTR, but just generally as a health information professional at a major system such as St. Vincent's?
Well, a lot of the positions today require that you have some type of health-related degree in order to even apply for the position. So I think having having her RHIT help benefit her in order to be eligible and considered as an eligible candidate for the position itself. Had she not had the RHIT degree, then her application would not have even been considered. And plus she had a background, health-related job background, so that also was a benefit. And then the anatomy and physiology was also a benefit.
Wonderful. Okay. Melissa asks, does your department offer any opportunity to shadow and get a feel for what the position entails? And of course, we know that people are the staff is on, what is it, on site. But if it ever does, like a quick view of a day in the life of a CTR.
Not necessarily. What we do have is, I tell students, if you're interested in getting into the cancer registry, the best way to shadow the cancer registry would be to volunteer in that department. So you would have to reach out to that organization to see if they're willing to accept a volunteer to come in and shadow and assist with cancer registry activities. That would be the best way. Typically, there's very little shadowing today for the profession, but volunteering would be the best route if you wanted to learn about the cancer registry.
And volunteering is good across the board. Melissa says thank you, as have all these students, Barbara. The last thing I would ask, if there are no other questions from students, is how do you see the future of the cancer tumor registry professional evolving? Do you, especially in light of it being now a remote position, what are your thoughts, Barbara, just from your personal perspective?
I think it's becoming more demanding. Researchers and regulatory standard setters are wanting to use the data more timely. So we typically, based on the current guidelines, we capture data 6 months from date of first contact, but that is definitely changing. With the release of rapid cancer reporting, which just released last month, standard setters are wanting the data real time. So I see my team focusing more on capturing data real time instead of retrospective today. So it is definitely becoming more demanding, and I think natural language is going to play a role in cancer registry in the future. So instead of the cancer registry having to manually kind of extract data, I think natural language will help with importing data from various EMRs into the cancer registry, where the registrar can validate the information instead of having to extract all the information, which would be, I'm thinking maybe 10 years from now or sooner, because we already utilize imports. So we import data from like Cerner, Athena, and Mosaic into the cancer registry repository, but it's only the demographics and the coders ICD-10 codes. It does not pull over all the treatment information. We also pull over the pathology information is imported into the registry repository, but everything else is entered in the repository via the certified tumor registrars.
It is fascinating that you said that term, natural language, because that is part of the health informatics, right? Where it's going to shift into programs and applications.
Yes.
Right. Mm-hmm. That will do not the work, because the work, as you're saying, is still on the health information professional, but there will be applications that will reduce error. I would assume that would reduce error as well.
Yeah, reduce error and then help with processes and efficiency.
Wonderful. Thank you so much. Are there any other questions while students are putting in their last few comments, or any questions? I just wanted to make aware of the students that for CEU credit or for credit in a course, please contact Dr. Banta directly by emailing her at charlenebanta@sjrstate.edu. I have placed this information in the chat, so just take a few moments to look. I do not see any other questions in the chat, Barbara, so thank you so much for
You're
all
welcome.
this information. I always find your thoughts, and that first time I visited you at St. Vincent's, I thought it was just so fascinating. So I do appreciate your continued partnership with not just St. John's, but with all of our students. Thank you.
You're welcome. I appreciate the opportunity to be able to speak. And if any of the students have any additional questions that I wasn't able to answer, just feel free to give them my contact information. Okay?
I will do that. Thank you. You have a wonderful afternoon, and thank you, class, for joining us.
All right. Thank you.
Bye-bye.
Bye-bye.
And the rest of you are absolutely welcome to contact Dr. Banta and let me know if you have any questions. I will be here for just a moment or two, kind of wrapping up, but otherwise, thank you for your participation and engagement. You're welcome, Taria. I hope I pronounced your name correctly. You're welcome, Melissa. You're welcome, Larissa. I am so glad, Suzette, that you enjoyed it. That's great. Well, at this time, I'm going to go ahead and mute. Everyone is dismissed. Please join us next month for the next health information, opportunities and health information. Goodbye.